Well, you're ready to continue our uh, great discussion. I have to say, my temptation was to shut the doors and lock them because I have a faculty member that did that to the students. Class started at 9 and he locked them out at 9:01. I thought, I think we need to clarify the policy a little bit. But anyway, well, this is a pleasure for me to introduce our next speaker. Dr. Donna Hedges, who I think you've probably seen her picture all over the materials. She and I have had the privilege of working together with now what's TRG conferences. And Dr. Hedges is actually not too far away in terms of where she's located in San Antonio, Texas. And she's the dean for Galen College of Nursing. And that's one of her faculty that's clapping. So I think that's appropriate. Give her a promotion, Dr. Hedges. Anyway, and the correct title for her presentation's on the screen. Somehow I thought this was an interesting, maybe it was Freudian, the social determinants of leering, which is what it says in the brochure. But please turn your attention to Dr. Hedges. Thank you.
Hello. I have to get used to using this. I have a hard time standing behind a podium, so I have to walk around. I feel like I'm like chained to something behind a podium. So I want to talk to you all about the social determinants of learning. Are you familiar with the social determinants of health? Anybody not familiar with social determinants of health? Okay, we're going to go through them. The social determinants of health is basically what I look at as the underneath the waterline of the iceberg. Because what you see, what you see is one thing, and what you see is influenced by what you don't see. So I will give you a little bit of an idea of Galen College of Nursing. We are a national nursing college. We have, probably by the end of this year, we'll have 25 campuses across the United States. With inside Texas, there will be 6, San Antonio, Austin, Houston, Dallas. Dallas-Fort Worth might be another location that we're looking at. We're also looking at El Paso, and then maybe McAllen down south. So when we think of, teaching new nurses, when we just heard about rural communities down south in McAllen, Texas, it's hard to put a nursing school down there if you want to teach anything above the LVN level. Because as an academic, you need to have at least a master's degree to teach BSN, and then onward, a doctorate to teach doctoral students. We have 3 graduations a year, and we generally graduate over 300 students at each graduation. We are a single-purpose nursing college. We have VN, ADN Bridge, pre-licensure BSN. We have also a master's degree with 2 tracks online, leadership and education. And we started a DNP program, I think it was early last year. And we have had conversations about a PhD program. So that's really, as far as I'm concerned, like off in the horizon somewhere. Our students generally are over 60% Pell eligible. And what that means is most of our students are on some kind of financial aid. Our diversity is almost 60% within our student population. Over almost 70% are parents. Most of these students are working 2 jobs at least. We really don't have a lot of students who you would find in other universities where there's either a funding source through family or through work. Our students come from a variety of places across Texas. At one time, because of the wait in California, we had a student flying in every week. to San Antonio to get his nursing degree because he can get into school, finish before he can get off the wait list in California. Okay. So when we talk about the social determinants of health, see if I can get this straight. I just turned it off. Am I going forward or backwards? The green button, the big green button, the big green button. Sounds like a game show. Right, social determinants of health. So, you guys are familiar with this, so I'm really not going to go into a big, long explanation. But where I want to tell you where we have the issues, economic stability, neighborhood and physical environment, food, social context. The healthcare system came along after the first five were established because in the United States, our healthcare system is in crisis. We've been in crisis for a long time. It seems like the crisis gets bigger as time goes on. Many of those factors are external to, let's talk about just academia. How do we get into school? How do we afford that? All the way up to, where do I take my child? I don't have insurance. We need to go to the doctor. So everyone shows up in the emergency room, right? And we've also already heard about through the other presentations what patients experience when they get in the hospital. And we also heard from the presentations what our students experience when they get into the hospital. One of our favorite lines is, well, now you know how not to do it, right? Don't do it like that, right? And we very much support, if you're not comfortable where you're working and you don't like it and you don't feel respected and valued, you need to go somewhere else. So how do we instill that? When we talk about professional identity, many of our students come with an identity that was formed within their built neighborhood. Some of our students, and this is an exaggeration, but it really kind of brings us the point home. Some of our students are uncivil because they have to be uncivil in their family of origin. Some of them, have to duck bullets and drug dealers and gang members just trying to get into their car. We have students sleeping in their cars, living in their cars with their children. Okay. So when we look at the student population that we have, most of our students would not be accepted at any other university because of their academic performance. And when they come in, we have 6, 7 really solid resources to help our students be successful. And as the dean, when we're getting ready to dismiss students, and I ask them, what resources did you use? They say, well, none. I'm not really someone to ask for help. I said, well, you're someone who needs to consider a different profession because every minute of the day, nurses are asking for help. But why is that? We have to ask ourselves the question, what are our students coming to us dragging? What's in their suitcase? Domestic violence, drug abuse, crazy making dysfunctional family of origin, violence to themselves. We have students who end up putting restraining orders on family members and partners, and we have to be aware of that in school, have their picture, get the whole thing, right? So we are taking people who have a dream and helping them achieve that dream. But I can tell you almost every day, maybe 3 times a week, it's like combat day. She's laughing. It's like combat day. Students will say the darndest things to you in your face in front of 12,000 people. And we have to teach them how to be nurses. We have to teach them how to be professionals. We have to teach them how to be adults. We have to teach them a different way of being and doing and acting and thinking. And I'm not even getting to the nursey stuff yet. We have to teach them, no, you just can't mouth off to somebody, right? So when I consider incivility, and it is a huge, keeps me up at night because I can't stand it. It's so detrimental to everything that we stand for. But I had this like epiphany, and maybe might not be an epiphany to you, but it goes along with what I just said. These students are coming with their armor on because that's their life. And so when you have a student who mouths off to you, we have to ask the question, what's going on? What's going on? Well, do we believe the best? Sometimes in our heads, we don't. We want to go, you need to get out of here, right? But that's not realistic, and that's counterproductive because these students are really trying. And if you peel away the layers of the onion, that student as a person is in there somewhere. And when you get to the core, we don't with all our students, but when we do, there's a broken person there. And every single one of us in this room have an element of brokenness. So how do we balance that? And when I say that, I was in new student orientation one day, and I warned them right in front, first day, you got to act like a professional. Don't mouth off. Here's what happens. This is what incivility is like. And so we go through that. And one day a faculty member came up to me and she said, Dr. Hedges, thank you so much for saying that, because I never thought about incivility that way. That this is a defense mechanism for some of our students. Now, is it a productive defense mechanism? No, but not all defense mechanisms are productive. We've got incivility, we've got drugs, alcohol, all sorts of things as self-defense mechanisms. So when we look at the social determinants of health, economic stability, employment, income, expenses, debt, medical bills, support. Some of our students have no support. I have many students who, my family's in over there somewhere, and I'm here by myself with my 3 children. And what do we say? We say it in practice and we say it in academia. Well, you need to make arrangements about your childcare, right? And that's easier said than done. But where do we strike that balance? Because we just can't go, okay, don't come to class ever. We don't have a child care center in our school. That would be a nightmare to kind of manage, right? So how do you as leaders, because I think there's more leaders than academics in here. How many academics are in here? Wow, we're like the minority. All right, it's the same thing. Leadership is leadership. Whether you are an academic or you are the head mug in charge of wherever you happen to work, leadership is leadership. Incivility is a profound leadership failure. So here we are trying to teach students and nurture them, and then also deal with their behavior at the same time. So I am never asking anybody to excuse incivility. What I am asking is, in the beginning, think critically about it. What am I seeing? You know, did you mean to say that to me in that tone of voice? Rather than, you out of here, or I'm going to write you up. Now, we do resort to writing students up because that's our process. We just can't let people run around saying whatever they want to say. But just know, as leaders in healthcare and leaders in academia, we are molding people who don't think they need to be molded. I'm perfectly fine. Thank you very much. Right? I had a student who threatened to, don't make me come up there to the 14th floor, and a variety of other colorful things. I dismissed her. She filed the grievance. She lost the grievance. She contacted me, 6 months after that. I readmitted her. And she was voted as the leader for that BSN cohort when she graduated that year. People have emotions. When you start to mess with people's money, their children, all that kind of stuff, it evokes a very visceral reaction. Our students, I believe, probably feel like they have to defend themselves. Sometimes students feel like faculty's out to get them. My chief nurse doesn't understand. Where is my chief nurse? Haven't seen him. her, them, right? So going back to economic stability, that makes a big difference. Our students, when they fail a course and they have to repeat the course, financial aid doesn't pay for that. So however many thousands of dollars that course is, they have to pay out of pocket for that. And that could mean whether I'm going to continue and be a nurse or I'm not. Okay. When we look at physical neighborhood and environment, here again, we know theoretically, and some of us from personal experience, how crazy making families can be. Mm-hmm. And sometimes people go way off track and get into things that they regret a lot later, and then they decide they want to come and be a nurse. And that's wonderful because everybody should have the ability to transform themselves. And none of us should get in the way of that. We should walk alongside and support that. But I'm telling you, it's not easy. It is not easy at all. So when we look at neighborhood and physical environments, housing, transportation, where do our students come from? Do we have an understanding? Do you have an understanding of where your nurses come from? What side of town? What side of the neighborhood? Is it a good neighborhood, a bad neighborhood? What implications do we have in front of us because of those external factors? Education, literacy. What is the United States adult reading level? 4th to 6th grade, right? That includes your students. That includes your nurses. Okay. When we think about language, I regret I never took Spanish. My 8th grade nun tried to get me to take Spanish, and I just didn't. And I regret that tremendously now because in Texas, we have language barriers out the wazoo because not only for Spanish, but we're an international nation. And I think for some of us, the amount of knowledge we have about other people's cultures can fit on the head of a pin. And we don't ask the question. And if I go back to students, we don't ask the students, what's going on? We want you to be successful. What's going on? Early childhood anything. You understand toxic stress and epigenetics? Toxic stress over time is shown to cause health problems later on in life, and also behavioral and psychological problems. So think of the people you have in your classrooms. Think of the nurses. Where have your nurses come from? What kinds of experiences have they had? Higher education, for some of our students, we have a subset of students who have another degree. Biology, some of our, outside of nursing altogether. And, I'm an accountant, I want to be a nurse. I understand that really well. Give me people who are ill over numbers, I'm okay. Right? Food insecurity and access to healthy options. The McDonald's and the Burger Kings of some of our neighborhoods are the place to go to on the way home from work at 7 o'clock after you pick your children up, and now you have to eat something. Everybody's happy. Everybody gets a happy meal. We all go to bed and we do the same thing the next day. If you think about that in terms of cognition, nutrition is very critical to being able to concentrate, think, stay awake, be focused. Community safety and social context. All you have to do is turn on the news. I know we don't have newspapers anymore. Pull it up on the internet. You know what's happening in your neighborhoods. You know what's happening on your nursing units. We've already talked about incivility. It's rampant. And many of the times that I have seen it in our students is because they are just struggling so hard, but they don't want to admit that they're struggling. So consequently, students get dismissed and never touched any of the 7 resources that we have, both online, in person, in modules. They just don't use them. Oh, so support systems, social integration. When we talk about social integration, that dovetails into professional identity. Who am I? Some days I wonder. and my husband used to say, who are you going to be today? And I would say, either Mother Teresa or the Marquis de Sade. It depends upon how I'm feeling, right? But really, it is a legitimate question. Who are you going to be today? Donna Hedges standing on her own. Who is that? Because as a nurse and as an educator and as a dean, I bring every blessed thing that has ever happened to me to bear in my attitudes, my communication, my actions, my decisions, all of that. Dr. Jean Watson says you can't separate an individual from their environment or from their support system. And realistically, the nurse or in education, the teacher enters into a relationship with the student. And my philosophy of teaching is we walk alongside you. Wherever you stop, we stop. You keep going, we keep going. We are walking alongside you because I'm learning from you as much as maybe you're learning from me, hopefully, right? We look at community engagement in some of the neighborhoods, that's zero. Stress, exposure to violence and trauma. And we could spend an entire conference talking about policing and justice, social justice. I think it's becoming absent in our environment today. When we look at the healthcare system, healthcare coverage, you have it or you don't. And if you don't, you're out of luck. You go to the emergency room and you get a Band-Aid and you get a bill for $25,000, which nobody can afford anyway, including me, right? Provider and pharmacy availability. I had a friend of mine who's a physician said, I handed this prescription to these people who were not from the United States. And I said, okay, so you take this to the pharmacy and you get this filled and you take your medicine. 2 weeks later, patient comes back to the physician and says, how you doing on your medication? She's like, what medication? He said, the white papers that I gave you. She pulls them out of her purse. She did not understand she had to take them somewhere, to a pharmacy, to get pills. Whose fault is that? And let's not even say fault. Nurses are beside themselves just trying to keep themselves above water. And I'm going to tell you, faculty are the same way. Faculty are the same way. And while nurses in the hospital have the burden of, I want this patient to live, I want to do the absolute best for this patient. Faculty say the same thing about the students. It's the same thing. Access to linguistically and culturally appropriate and respectful care. When I was a clinical instructor years and years ago, there was a thing on the care plan that said that the paperwork that they had to do spirituality, and they would put NA. Does that mean they didn't have any? Well, nobody's comfortable asking about somebody's spirituality or their culture. Right? So people come into the hospital, they come into school, their English language as a second language. And now we give them all these really nice standardized tests and computerized tests, and we go pass, right? It's difficult. And really, to tell you the truth, as a plain white, vanilla white person, I don't have nearly the understanding of what our students go through. And far be it from me to second guess. Do I get irritated? Absolutely. But I'm not in their shoes. And so my problem is, where are my biases? Where are my judgments? Where am I making assumptions? Where am I not looking at things correctly? What information am I missing? Just the same way your nurses do, hopefully with the patients. And then quality of care, quality of education, right? Students are customers. I had a student at another school tell a faculty member, I pay your salary. So I went in the next day and I said, hey, I was wondering who I was supposed to ask for a raise from. It's you people. I need a raise, right? there's assumptions thrown about on each side. So Chamberlain University has developed a framework of learning. And you can just pull it up on the internet and you will see this diagram. The diagram is originally from the Office of Disease Prevention and Health Promotion. And what Chamberlain has done is put an educational spin on it. So when we look at it, we have physical health, psychological health, psychosocial health, economic stability, self-motivation. Do you ever have anybody say to you, how are you going to motivate me? I say, I don't know. I'm just trying to motivate myself. Let's talk about how you can motivate you and how I can help, right? Social environment, physical environment. Okay. And on the outside of that circle, if we start at 12 o'clock, institutions, culture, and activities. Do you realize that as nurses, we defend our profession? And when our students come in, we look at these people and we go, that one's not going to make it. They're not going to make it as a nurse, right? What is our culture? And are we talking out of both sides of our mouth with our culture? What activities do we have? At our campus, we have started circles by request of the students. We have LGBTQ plus circle, men in nursing circle, Black nurses circle, Hispanic nurses circle. We might be starting a first generation nursing circle because almost 70% of our students are culturally diverse. So the students come in and ask us, hey, can we have a voice? Yes. Then we look at the faculty and the curriculum. You look at your nurses and the processes within your healthcare organizations. Are the right people in the right places? Sometimes we go, well, we can't do without that one person, so let's kind of gimp them along. That really never works out well. Faculty have a hard job. They have a hard job because as dean, I probably place a lot of expectations on their shoulders, as I do myself. But they're already tired and burnt out, and they're going to battle in the classrooms because some of our students just are very open with what they want to say. And the faculty are put in a bad place because what do I do now? I've got 45 students in this classroom. I've got this one person mouthing off. I send everybody out. Do I go get security? It's a very awkward and very difficult situation. The curriculum. Here's where I think I have a concern about professional identity. And one of the things you said, Dr. O'Rourke, was you mentioned skills versus, right? So when our students come in, what do we teach them? Do we teach them professional identity? What do we teach them? Skills. When do we teach them professional identity? Senior year, where they're like, can we just get out of here, please, and you shut up? That's what happens in senior year. We know it now, right? But think about that. In our world, that's 12 weeks. I can't teach somebody to have professional identity in 12 weeks and have them adopt it. So my question is, when we have students who are having their first nursing course, and this is the truth, we're talking about BSN essentials. Why? That's the pillar of our curriculum. What does that have to do with somebody who doesn't know how to take a blood pressure? But can they understand what it is to be a professional nurse or what's expected of a professional nurse? You can start that day one and gradually get that more complex so that when they get to senior year or their bachelor's degree or their master's degree, they already have this developing, and that's what you can mold. We work with what's under that waterline, but we can mold students who want to do differently, who want to learn, right? And students who can. Some students have had some experiences that it's just really hard to get over, and they need to go get counseling. We have a school counselor that's free to them, completely confidential. environment. What is the environment in our schools and in healthcare? Now, in healthcare, you've had very serious things where somebody walks in and decides to shoot somebody, right? We had a false active shooter call last year, and the building we were in at the time was 15 floors, and we occupied 7 of them. Where's the active shooter? SWAT's running down the hallway on the 3rd floor. Okay, let me go find out what's going on. Right? Did our students feel safe after that? Did our faculty feel safe? What is our environment? So you come to school and you don't feel safe, how are you going to learn? Okay. When we look at administration, that's me. You should wear a big A over here, because when they talk about administration, they're talking about me. And that's okay. But what's my view of how that culture should be? What's my view? And just because I'm dean, that doesn't mean everybody goes, yep, that's what Dr. Hedges says. We got to do that. No, what's, I'm going to talk to you later. What's my view? Because when you talk about all these things, listening and professional identity and all of this other stuff, you don't have to say a word. What do you role model? If I can't role model what my belief is and how I believe students should be able to identify themselves as professionals, feel safe. If I'm not role modeling that and my faculty aren't role modeling that, we're in trouble. We are in trouble. And I have to take care of the faculty so the faculty can take care of the students. The students are not my priority. The faculty are my priority. The students are the faculty's priority. That doesn't mean I don't care, but that's my front line to assist our students and help them get to where they need to be and brush themselves off when they get verbally beat up by somebody. That's when I show up and we have a conversation about incivility. Campus life, it was difficult where we are. We're in a new building now. It's like we all died and went to heaven. Students are upset because of the parking. We have toilets that flush. We have air conditioning. We have heat. I'm telling you, this is come and gone in our old building. Parking's an issue, right? So what we're going to start to do is go, yeah, parking's an issue. We're working on that. Is there anything good that you've seen that you like? Look around, right? Because we don't want to minimize our problems, but we want to also balance them with what have we been given? Our students understand where your nurses come from, understand where your students come from. Because if we don't understand how social determinants of health can impact a student's ability to learn, we're missing the boat. We're absolutely missing the boat. And some students need more than other students do. And probably the same thing in your healthcare organizations. So when we think of the context of what we're trying to do, what we say is like I said before, we're guarding our profession. Do you know, I have people running around places in the past where I've worked. It's like, you don't deserve to be a nurse. To a student. How do you know? What contact lenses are you looking through? Because what I see is a person who has some issues. They're struggling. I can't fix that, but how do I mitigate it? And how do I figure out what's the fundamental issue? It's a question I always ask myself. What's the fundamental issue? How do I address that? And it's not easy because nobody wants to talk about all that stuff that's under the waterline, right? So think about social determinants of health in the context of what's under that waterline, because what's under there will greatly affect what you're seeing. And if we don't understand the connection between the two, we're going to miss it. And our students are not going to learn. And they're going to study enough to answer the right questions on NCLEX and go on to be a nurse, carrying their shield and their sword and their whatever into your professional settings. So in academia, just like in healthcare, you have a profound responsibility. Our profound responsibility is to have our students trained enough so that they can enter your organizations and take care of patients in a safe, practical, evidence-based way. Some students can make that jump and some can't. So what we try and do is support our students, try and understand what's the background of all of this before we even get to, well, you got 43 on that first exam. What happened? Right? So in closing, what did I do with this thing? My ask to you is to think twice with your nurses, with your students, with your colleagues. What could possibly be going on? I want to figure out how we're going to start teaching professional identity day one. And I don't think we do a good job at that, not because, we don't want to. There's so many things. You remember your nursing school. It was like learn everything, and some of it you still apply. Our students, who are you as a person? They don't even know. Next step, how do you develop your professional identity? Because the personal identity is not congruent with the professional identity. And that's the challenge. But we're up for the challenge because we believe in our profession and we believe in the people who are going to be taking care of us, right? I'm 64 years old. I tell the students, I want to be happy when I roll into your ER and I see you instead of saying, take me back somewhere else, right? So that's what I offer to you, to just pause and think about what's under that waterline, because that's really what we're dealing with rather than what we can see above the water. I am so grateful to be able to be here with you today and to talk with you about this. It's something that's very close to my heart. So, the sun's still shining. We have a lot of issues going on. We're not even going to get into politics and all that other kind of stuff. The question is, what are we going to do about it? So on behalf of my family and me, thank you very much. How do I turn this